Hello and welcome to Motherhood. I'm Dr. Christina Hibbert, or Christy, as I like to go by, and I'm here to help you overcome, become, and flourish through this interesting ride we call motherhood. Now, I hope that you're here because you, like me and all of us listening, understand that motherhood is not always easy, it's not always fun, it's not always joyful, but we sure do grow a lot through it, don't we? And I'm here to help you choose to grow through motherhood rather than just choosing to go through motherhood. If you're going to have to go through it, you might as well grow through it. And that's what this show is all about. And one thing that I love about this show is that it's a place where you as moms can come each week, give yourself a little break, have a little time for yourself to learn something new, to connect with other moms, and to find a sense of community here. That's what I'm really hoping this show is about for you, because that's what I'm trying to do here. And I'm really excited to announce that I just set up for us a Facebook group for this motherhood radio program where we can all connect and share ideas and support one another and ask questions. And I'm hoping you'll go and join up with that group. Now, if you go to Facebook, if you're on Facebook, go and search for Motherhood, Overcoming, Becoming, and Flourishing, and you'll see the group, and then you can just ask to be added to the group. And of course, if you ask to be added, I will add you. And then I hope you'll participate by sharing a little bit about yourself, asking questions, and we can discuss the shows as they come up. And just in general, we can support one another as moms, because don't we need it? There's always something going on in our lives as moms where we really need support. And that's something that we're going to focus on today's show too. Today's topic is one that probably all of us can relate to in one way or another. It's called Help for Picky Eaters and the Moms Who Love Them. Now, whether you have a picky eater or not, we can all probably relate to those times when our kids just don't want to eat what we want them to eat, or they just kind of stop eating everything except one certain food. So I was kind of trying to think of how eating has gone in my life with my kids. And, I have kids now ages 7 through 19 almost. And I was thinking about, when they were first born, and how, breastfeeding is part of this, whether we choose to breast or bottle feed, and how we feel about that choice. And if we choose to breastfeed or bottle feed, is the baby able to actively participate and to establish that relationship and to eat and to grow? And then, as they get older, it's about kids that suddenly, toddlers, everybody knows this, toddlers get picky. They only want to eat the grapes. They don't want to eat the vegetables that they were eating before just fine. Suddenly they only eat a few bites and then they're done. And it can be confusing for parents going, wait a minute, you need to eat. And then when they get to school age, how I know that my youngest right now, she's sort of all she wants to eat is like chips and macaroni and, all the unhealthy foods, and I'll present her with the healthy foods. And it's sort of like, well, you need to eat some of the healthy foods with the unhealthy foods at least. But they sort of get into this mode of, I'm only going to eat these 5 items and that's it. And you hope that they grow up and grow out of that. But I'll say that as teenagers, it can be even worse sometimes. Sometimes the teenagers can be adventurous eaters, and sometimes they're just picky. They just want what's easy, what's fun, what tastes good, right? And even my college student came home and was saying, Mom, there is nothing to eat, as he's looking into the fridge and the cupboards. And I'm thinking, what do you mean? I just went shopping. There's all kinds of healthy, delicious foods in there. And in fact, I was making a salad for myself with salmon and salad. And I was like, you can have some of this. And he's looking at me like, are you crazy? I am not about to eat fish. That is disgusting. And salad and fish, how gross is that? So, it can take a while for us to grow up and to get out of that picky eating phase. And I think in one way or another, we can all relate to this topic. So that's why I'm excited to jump in to talk about help for picky eaters. And it's not just about even helping kids eat better or eat more. It's also about dealing with the tough emotions that go along with when our kids choose things that we don't want them to choose, when they choose to be unhealthy or to eat foods that we don't want them to eat, and also when they make other choices and how that impacts us as mothers and how we feel about ourselves. We're going to talk about all of that today as well. So let's go ahead and jump in, and let me introduce our guest for today, Jenny McGlothlin. Jenny, welcome to Motherhood Show.
Thanks so much for having me.
Oh, it's such a pleasure to have you here. I know you have such great expertise in this area. And for those of you listening, let me tell you a little bit about Jenny. Jenny is a certified speech language pathologist, and she actually works at the University of Texas at Dallas in their Center for Communications Disorders. Jenny also specializes in the evaluation and treatment of feeding disorders for children. So as you'll hear today, she really does understand not just the frustration that moms can feel when we can't get our kids to eat, but also what's really going on with the child when they're having problems with their eating. In fact, Jenny developed a program called STEPS feeding program. She's going to tell us a little bit about that later, but she uses that to work with families to help them foster feeding skills that can help the child for their whole life long. And most recently, Jenny has published her first book with a co-author, and it's called Helping Your Child with Extreme Picky Eating. It's available on Amazon and probably on newharbinger.com, I'm guessing. That's the publisher, and that's how we met. New Harbinger is the publisher for my book, Who Am I Without You? And so you can go there and find her book as well. And she's going to share all these insights, as well as she is also a mom. So she gets it. She's a mom of 3, and she really does get all of this that we're talking about today, all this crazy motherhood that we're always discussing here on the show. So again, welcome to the show, Jenny.
Thanks.
We're excited to have you. So let's just jump in. And, we were kind of talking a little bit, or I was talking a little bit in the intro about some of the worries that we might fear or feel as moms when it comes to our kids and eating from all different stages, from the time they're little all the way through when they're older. What, in your experience, since you've worked with so many families in this area, what has your experience been as far as some of the common fears and worries that parents might face when it comes to eating in kids?
I think it's such a big issue for families because it's our job. We have a baby, or, we start out as parents, and that's our job, is to feed the kid and to make sure that they get enough nutrients and that they're growing, and every weight check we go to at the doctor's office. And so I think that's the biggest fear, is just growth and making sure that the child is getting what they need to develop and to, be strong and healthy. And, because I think that, if a child isn't growing, the family only can see that, and it's a day in and day out pervasive issue if a child doesn't eat well, from one meal to the next. If that's going to be a stressor for that family, then it really happens all day long.
Right. So, right. I mean, that can be probably the most scary thing that we might face, is that our children just really aren't reaching those developmental milestones. They're not gaining weight. And especially, I'm thinking of, moms with newborns and how this really impacts new moms with young babies, because you're constantly going to the doctor and they're constantly telling you they've gained 2 ounces this week, or not. And if they're not, then somehow you feel like there's something wrong with you, when that's not necessarily the case. So obviously that's a big fear for moms of all ages, but I would guess especially for new moms, especially maybe first-time moms, because you just don't quite know what to expect.
No, and I think, especially for first-time moms, they depend on their pediatrician to inform them about what's going to happen and how it's supposed to go. And when they have any problems or bumps in the road, or, things that aren't going quite as the book said, they've got their parenting books, but sometimes it just doesn't go like everyone says it should. And so I think, when they don't have a good support system, or somebody that really understands, okay, this isn't necessarily just about what the mom is doing or not doing. It can be also about what the child brings to the table. And I think that's that missing piece. A lot of times when I talk to pediatricians about this, because, my child's pediatrician, they also send me patients. They send me lots of babies. And so, we have conversations about this all the time. And he says, we don't get any of this training in school. Like they go through all of this training, but this is not something that they train for. This is why there's a specialty. This is why speech pathologists specialize in feeding, and because there isn't, there's not a medical profession that does that. So
let me interrupt you there, because I think a lot of people don't know that about speech pathologists. They probably do think that their doctor is the one that's going to help them with feeding issues with the child. And the other point that I wanted to emphasize that you made is that it's not, we forget that the child has a role in the eating too, kind of a big role. It's their eating that we're really worried about.
Right.
We take it as our problem, especially maybe with like a newborn that won't latch on and won't breastfeed or something, but the child can have actual feeding problems. And,
Oh, yes,
and
absolutely.
you, in your role, you actually can help the child learn how to use their mouth and how to eat properly, whereas
Right.
a pediatrician might not understand that.
No,
Yeah, that's
no. And my co-author is an MD, and she was a family doctor, and she's the first to admit, like, she didn't know anything about any of this. And so it's, we, in our training, we study the anatomy and the physiology of the swallow, which is, part of the swallow is getting the food ready to be swallowed. So chewing and moving the food around, and as an infant, sucking, the suck, swallow, breathe that we see babies doing. And so when any of those things goes wrong or isn't working properly, or there's some muscle weakness or anything like that, or there's pain because there's reflux, or anything that's going wrong, that baby is going to communicate that. And this is where we see very fussy babies, or babies that aren't feeding well, or they feed for a little while and they stop, so they don't grow like we expect them to, or like we would like them to. And so I think it's really important for families to understand that it's not just what they're doing or not doing, but what the baby, what their skill level is. If they were a little bit premature, or even if they were full term. We have full term babies all the time that struggle.
Yeah. Well, that's important to know. And I think you're touching on a really important fact for all moms out there listening to remember, because I'm thinking of when my firstborn was a newborn, and I had no clue what I was doing, and I really did have trouble with nursing him, and I couldn't get him to latch on right away, and I did have to start supplementing with a bottle right away, because he was a big baby to be born and all that. So I wasn't necessarily worried about him losing too much weight or getting too small, but at the same time, I really felt like it was my fault that he wasn't able to breastfeed. He wasn't able to latch on, and I did go to a lactation consultant, and that did help, but I really felt worried that I didn't know how to be a good parent, afraid that I wasn't going to be able to do this right, because that's like your main job, right? To feed your child,
right,
especially when they're a baby. And if you can't do it right, or a lot of moms, as I know, feel like a failure if they have to not breastfeed, or if they choose to not breastfeed from the start. And really that's just such a personal choice, but it can mean such big things for us as moms.
Yeah, and I meet a lot of moms who are having trouble with breastfeeding. A lot of moms that are having trouble bottle feeding their babies, for whatever reason. I mean, it happens in both realms, and it's in those situations when they get to me, it's not about what mom is or isn't doing. She's tried everything at that point. It's there's something going on with the child, and there's a lot of ways to support the child's development. But I think the mom has to come to that place of realization that they are just one part of that partnership. They're just one piece. They're not, it's a dynamic, it's a feeding partnership. It's not just I'm doing this to the baby, or I'm doing this for the baby has to participate also. And that can help, I think, when parents understand that and can see it's two-sided.
Yeah, that is a really great point that you just made, and I hope all you moms out there are listening. It really isn't just about you. It really is a partnership. And I know in your book you talk about relational feeding, I think is the term or something. We'll talk. Hopefully you'll talk about that a little bit more later.
Sure.
But I think it touches on that idea of that this is a relationship, and that we each have our responsibilities when it comes to eating, and it's not just about us and what we're doing as parents. A lot of times, like you say, maybe really the child does have an actual physical problem that needs attention, or an emotional problem that needs attention, right?
Yeah.
But as you know, this all comes along with a lot of judgment from other people, right? We get feedback all the time from doctors and family members, maybe even our own spouse or partner has some opinion on what we are or aren't doing. So what have you seen as far as what kind of judgments, I guess, have you seen that people commonly face when it comes to kids who are picky eaters, and how does that affect us as parents?
I think it has a huge effect on just our confidence as a parent, I think, because it is such a pervasive judgment in our society right now. Just everybody has an opinion about food, and there's a lot of really strong opinions out there. And when parents choose to feed their child a certain way, or the child doesn't choose to eat the food that's being presented, and they will only eat a certain number of foods, and those are the foods they're comfortable with, that parent sometimes is at a loss for what to do. And so the judgment that comes from other people as far as, oh, well, you shouldn't feed him that crap and then he'd eat healthier. We hear that all the time. If you just didn't have it in the house, he wouldn't eat it. He would eat healthier. Or if you just let him starve and be hungry, then he'll eat what you put out for dinner. And in my experience, and believe me, I've seen hundreds of families who struggle with feeding issues with their kids, and it's not the case. I've had so many families try the tough love approach and say, oh, well, it's this or nothing, and it doesn't work. The child basically is just hungry, and then you are missing out on that role of nurturing your child when you follow that line of thinking. And I think, it's a really difficult line, I think, for families, because if you've got friends and family members and a spouse or someone telling you, oh, you should just do this is what worked for me, then of course you're going to try it if you've tried everything else. But every child's different, every family's different, and what worked for your pediatrician may not work for you if your child truly has selective eating or extreme picky eating, or one of the many labels that we use for these kiddos. But it's hard.
That's a good point, because I think a lot of us think, oh, well, they're a doctor and they're my doctor or my kid's doctor, so I have to do everything that they say, and they don't always know exactly what we need, and maybe they're not the exact right specialist for what our child needs. Maybe your child needs somebody like you, Jenny, right, to help them with their actual eating. Maybe they need someone like me, sure, a psychologist to help because they just have so much anxiety or something. There's a lot more resources out there when kids are having trouble eating. Now, what you also touched on was not only how these judgments from others affect us as moms, but how it affects our children. So how do these things affect our children? Because I can kind of have this vision in my mind of dinner time and, everybody having their opinion about how the kids should or shouldn't be behaving or eating, or what they should or shouldn't be doing. And what impact does that have on our children?
So we talk about something in our book called the worry cycle. And what that is, the child usually presents with some kind of issue. So either as an infant or as a toddler, there's some kind of feeding challenge, right? So where the child is just not doing well in some area. Well, what that usually turns into is the parent pushing and pressuring and trying to get the kid to eat. I need to get more calories in him. I need to get him to eat vegetables. I need to get him to take this so many ounces. And then what the child does then is push back and resist that pressure, because they're trying to maintain their autonomy, and their control of their own body. And so they're usually communicating something's not right, something hurts, something's uncomfortable, I don't like how that feels from a sensory standpoint, or temperamentally, I'm just really anxious or emotional about this, and I don't want you to tell me what to do. And so when they push back, a lot of times the parents pressure more and say, well, if I just, draw a line in the sand and I don't give in, then this is, it's going to get better. And we kind of talk to parents about what happens in this process with all of this pressure at the dinner table is that there's no joy, there's no peace, there's everyone's upset, everyone is stressed out, everyone comes to the table with a pit in their stomach because they don't want to sit through another awful meal with their child. And so, and I always say, if you have butterflies in your stomach, there's no room for food. You can't,
exactly.
You just, if you're nervous or you're upset, you just don't feel like eating. And so when a child comes to the table expecting to be pressured because that's the way their whole life has been, they are already set up to have a really low appetite and to have no interest in the food that's on the table. And all they want to do is get out of there, right? So it's a hard situation. And I think people get into that cycle and they spiral down. And we've had parents talk about feeling like they're in a black hole, because they can't get out of it, and they just feel like every meal is a battle.
Yeah, I could see where not only the child and the parents, but the siblings, like everybody probably doesn't want to be there because it's, oh, here we go fun. Again. Mom and so are fighting again, or mom and dad are fighting because the baby won't eat or the toddler won't eat the food that mom prepared or whatever. And it would make you not want to be at the dinner table at all together. And we already have such a tough time getting families to eat together anyway, right? So we need to make it probably as joyful as we can. And it sounds like this can be a big challenge when you just have picky eaters involved.
Absolutely. And I think there's so much research being done about family dinners and, family meals and how important that is. And I think the benefits that we glean from those family meals, they're completely outweighed by any sort of anxiety or negativity that's going on at the table. So in order to get those conversations going and to have those sharing moments at the table that are so important for the benefits to be reaped, it's really crucial that there is peace at the dinner table. And so the things that we discuss in our book are really starting with removing that anxiety and just taking the pressure away and allowing the child to be their own person and to make their own decisions. And we talk a lot about the division of responsibility in feeding,
let's talk about that, because that's an important point, and it helps us parents understand what we can do. Like you say, we need to reduce the anxiety around eating and around family dinners. And like you just mentioned, I mean, it is so important, but you're right. If we're not doing the family dinner the correct way, then what's the point? It can also, it can probably be more detrimental than anything else. And I was also thinking, when you were just talking a minute ago about how all this impacts the child themselves, is, gosh, it would really impact their self-esteem and self-worth, sense of self-worth as well. I mean, just not even just surrounding food, but just in general, that they're always wrong, I guess, in a sense, for what they're doing. And that can create a lot of tension too. So so this division of responsibilities idea is really helpful. So explain what you mean by that and what our role is as a parent versus maybe the child's role.
Yeah, so the division of responsibility was coined by Ellen Satter, and she's a dietitian. She's also a family counselor, and she really sets it up for you, where your job as a parent is to decide what the menu is and to decide when the meal is happening. So you're in charge of the logistics of the meal. So getting it on the table, deciding the schedule. And the child is really completely in charge of what they choose to eat from what's available, but also whether they eat certain things. They're not supposed to have to eat everything. They're not supposed to have a bite of everything. And I put parents in their child's shoes a lot when I say, picture the food you don't like at all. For me, it's raw oysters. I just can't stomach them. Yeah. And picture that food on your plate every time you sit down for a meal. And what does that do to your appetite? What does that do to your whole sensory system? Do you feel just overwhelmed? Do you want to eat the other food that's touching it? Do you want to eat it all, or do you want to run from the table? And, putting ourselves in the child's shoes and making that connection can really help parents realize, if I wouldn't say it to my spouse, why would I say it to my child? There's that respect that's such an inherent part of autonomy and, respecting another person's body and their boundaries. And I think that for some reason, as a society, we've really gotten away from that, and we feel like we have to control food when it comes to our children. And the research is really clear that the more we pressure, the less they eat. It's a very robust finding over and over again that, the more pressure and anxiety kids feel around food, the less they like it. And, setting things up like, oh, well, you can't have your dessert until you've eaten your vegetables. Well, the research is pretty clear about that too, that bribing with dessert actually makes the child like the dessert more and makes them like the vegetable or whatever it is less.
So it doesn't work, parents out there. Okay. So you moms listening, you can relate to this, because we probably all were raised with parents, or many of us, who said you can't leave the table until you eat everything on your plate, or you eat the vegetables or whatever, or using dessert to say, okay, let's, you can't have your dessert until later. And I bet most of us have never heard that actually doesn't help us get our kids to eat. They might eat it right in that moment, but down the road, they're less likely to eat it.
Yeah, because it's that whole idea of having to kind of muck your way through the broccoli to get to the food that's on this pedestal.
Right.
You know, if you've placed the brownie on the pedestal and said, this is the golden food that you have to do all of this work to achieve, you've now made the brownie really important, you know, and you've made the broccoli just seem like dog food. You know, it's not something that you want to have but you know, and it's so interesting. And I serve dessert with dinner. So and that's something that we talk about in the book too, is one serving of dessert. There's only one serving of dessert. That's the caveat, but one serving of dessert with dinner, and they can eat it whenever they want. And it's freeing, because what happens is they're not constantly asking you, how many bites of lima beans do I have to eat before I get my cookie, you know, and, or, you know, what are we having for dessert? What's for dessert? You know, so it just takes that out of the equation, and you can just stop worrying about it. And it's really nice. I mean, my 2-year-old, she'll go back and forth between, you know, the ice cream and her sausage, and then the ice cream and her spinach, and she goes back and forth. And most of the time she leaves the dessert half finished, you know. She doesn't ever finish it, because it's not a big deal. It's all food.
Oh, that is a great tip. I have never heard that suggestion, but what a great idea, because it makes a lot of sense what you're saying, and it's backed up by research. You know, they've really studied this a lot, and it makes the mealtime just so much more peaceful. And so your idea here of dividing up the responsibilities, so you moms out there, our responsibility, what Jenny's saying is, our responsibility is to provide the food, and then the child's responsibility is to eat what they eat. And I think your point, Jenny, about what if we were provided with a bunch of foods we hated and we were forced to eat them every time. I mean, let's face it, if we're making dinner as moms, we kind of get to pick what we want to eat. So, exactly. So we're kind of lucky. And I do think about that sometimes, like when you go visit somebody and they have some meal and you feel guilty, but you just really do not like it. So you're trying to pick at it. Well, kids can feel like that all the time, I guess. And I really hadn't thought about it that way before. So we can take some of that pressure off ourselves, is what you're saying, by sort of putting it out there for them and then letting them decide. And I think you also use the idea of that we should just not serve our kids on their plates, right? But just put it all on the table. Right. Yeah. So it's family style serving. The idea is that, you know, when you pre-plate or you give a child a plate of food and say, this is your dinner, they are then expected to eat what's on their plate, even if it's not what they would have chosen. And so when you put just everything on the table in the middle and let them serve themselves, and you pass the food around, what it does is it gives them neutral exposure. So it allows them to see a food, smell a food, pass a food, maybe scoop some food onto your plate for you, but they're engaging with the food in a non-threatening way, but they don't necessarily have to eat it right then. You know, they may be kind of, as I kind of call it, sneaking up on a food. So if there's a food that they're interested in, but they're just not ready to try yet, they can just keep asking you about it, and you can tell them about it very matter-of-factly, but it gives them that opportunity, but then they're not expected to, because a lot of kids will take that first right of refusal. You know, they see it on their plate, I don't like such and such, I don't want this, you know, especially toddlers, you know, and preschoolers, they will take it off their plate and throw it back at you. So, you know, and so, you know, when you just have it on the table and they see it out there and they don't have it on their plate, the little ones most of the time will reach for those foods and be like, I want that one. Why don't I have what you're eating? Right. And they want to participate. They want to be like everybody else. Oh, that's interesting.
That's why the family meal is so important, is that modeling behavior, because kids learn to eat what the family eats because they trust us. They trust that mom's not going to eat something that's poison. So, you know, that's probably something I could try too. Oh, mom's eating it, I want some too, you know. And so giving them that opportunity to see us eating it and enjoying it, but not pressuring them and just letting them do it, really makes an impact. And it can change literally overnight. That anxiety and that interest can get so much better within a couple of days. And I've seen families go from just a full-on battle to smiles and asking for food. You know, just by doing this simple tip.
Yeah, these are great suggestions, and I can imagine where just anything you can do to make it more fun around dinner time, in addition to this, you know, put on some music, eat outside at the picnic table, you know, do whatever will kind of interest your children in something different. You know, I know if I ever set the table in the dining room, it's like, whoa, why are we eating in here? It's so fancy, you know. But it's just something like that can make a big difference too. And I'm thinking of, you know, I think one of the biggest issues for moms surrounding all this is like you mentioned earlier, there is all this pressure to be, not only for our kids to eat healthy, but for us to be healthy, like you said. I mean, it goes both ways. You know, there's tons of commercials and infomercials, and there's the organic section, and there's, you know, the regular foods, and how are you eating, and what are you eating quinoa now, and are you eating kale, and are you having your smoothie, and, you know, whatever the new fad is. And it's great to eat healthy foods, but yeah, it's hard to keep up with all that, and it can feel like a lot of pressure, especially nowadays. I mean, who would have thought 10 years ago that people would be posting pictures of every meal on Instagram? I mean, really. I know. It's like, and then you see this is what I made for my family. And you're thinking, oh my goodness, I'm such a loser mom because my kids will only eat the hot dog and the macaroni and that's it. And I can't get them to eat anything, you know, and it can just really get to us. In fact, I have to admit something. I was shopping last weekend. And it was the day before Father's Day, which also happened to be my husband's birthday. And I was stocking up. I went there to buy items for his birthday. And so I had started in the vegetables and fruit section, the produce section. And I had filled my cart up with a bunch of stuff that I wanted, you know, some of the vegetables and fruits that I like to eat. And admittedly, I'm like a total extreme eater. I'm totally healthy, and then I'm totally not. So I'll eat a salad so that I can have dark chocolate or have dessert, you know? So I like both, right?
It's all good.
And so anyway, I had this stuff in my cart, and I saw this couple that I knew, and I happened to know that this couple is really a healthy couple, and they have a large family too. They actually have 7 kids. Now, granted, their kids are littler and they're girls, so, you know, my kids are, the older ones are all boys and they're teenagers, and I'm sorry, but teenagers are just about as picky as any other toddler or baby or whatever. But, I kind of joked with them because they said, oh, look at your healthy basket or something. And I said, yeah, I'm just stocking up on all the healthy food so that, you know, I can pile all the junk food on later. And they're like, ha, ha, ha. And they said something like, well, why don't you buy the junk food first and then put the healthy food on top so no one sees the junk food? And I said, oh, no, this way when I put it on the conveyor belt, all the healthy food will be last. So that's what people will see in my shopping bags on top. And ha, ha, ha. And then we walked on. And then as I went, I was being serious when I said I was going to be buying a lot of unhealthy food. And I was buying a lot of boxed stuff for my teenage boys that I was going to be leaving when I went out of town this week. And I bought my husband a bunch of treats that he wanted. And I bought them some soda, which we usually don't get, but I was buying that, and a cake and all these kinds of things. And before I was thinking in my mind, I'm so glad that I don't see them now. When my cart
judgment.
My cart was so full with just like fruit snacks on the top and all this candy and stuff. And lo and behold, as soon as I thought that, there they come around the corner, and they had like hardly anything in their basket. I don't even know what they were shopping for or how they feed their large family, but I started laughing. I was like, see, I wasn't joking. They're like, whoa, you weren't kidding, you know, and ha ha ha. And I literally my daughter was with me, and she had just put the big thing, I'd caved, and she'd bought the big thing of the cheese balls. Oh, those cheese puffs. Yeah. Oh my gosh, my kids love, and I just know they're so bad. But you know, I felt so judged, and I admit I wanted to like run away and hide. I didn't want anybody to see all that stuff. And when I was buying it, I wanted to put it in my cart, and literally I did want to put all the vegetables on top. Yeah, exactly.
And I have to tell you, I have so many families where they literally wish their kid would eat a chocolate bar. They wish their kid would eat a Cheeto, you know, because they don't eat or they can't eat. And so it's a really, you know, it's so important, I think, for families to understand that it's all relative, and that when your child can't eat or won't eat anything or has 3 safe foods that they will eat, and that's it, that when they do eat at the table and they eat happily, that's all you care about.
Oh, I like that. That makes me feel better, and hopefully all you moms out there listening that have the same struggles that I do with kids who want unhealthy treats and snacks all the time, you can remember this. This is a good point. And, you know, it reminds me of a client that I had. I think I shared this story with you before, but that she had a 3-year-old who was just really not eating and not gaining weight. And she came to a session with me, and she was really upset. And she kept saying, like, I don't know what to do. And I just feel like the worst mom ever because my child will not eat. And I asked her, I said, well, will she eat anything? And she said, yeah, she'll eat hot dogs and she'll eat ice cream, and that's about it. And so I said, so are you feeding her hot dogs and ice cream? And she's like, well, I don't,
No.
that's not good for her. And I shouldn't be. And it's like, well, but you know what? She's not gaining weight. And right now you just need her to eat something.
Yeah, yeah,
Right?
exactly. It's all calories. And for kids that have, what we call extreme picky eating, the calories are all that's important. And, registered dietitians, when they do nutritional analyses of these kids, and, we eat, our society, we have all these fortified foods. We have all these foods that have added minerals and vitamins, and a lot of kids nowadays are taking multivitamins, and, and the hot dog is protein, and even if it's not the protein you want them to eat, it is protein. And so I think when we look at kind of the big picture and say, okay, well, what are they eating? It's usually more than the parent says. It's usually, there's usually a few more items in there that they will eat. Over the period of a week, they're usually meeting their nutritional needs. And actually, the area that we see kids not meeting their nutritional needs is sometimes iron, and that's where sometimes we need a little bit of help with a vitamin or something like that. And getting that tested is usually the only test that we actually refer a family to go have done with their family doctor. But
and parents too. I mean,
usually,
a lot of women struggle with iron. I mean, so that's not just kids either, right? There are some things that we just can't get from our foods, even as adults, right?
Yeah, and and I think to expect kids to eat a nutritionally, complicated, and to eat like myplate.gov and to really do that at every meal is really impossible. And kids don't eat like that, especially little kids that are developing their preferences and developing their I do it, they're in that independent stage, and they just don't want to be told what to do or how to do it. It's important for us to remember that they may eat very erratically, and their growth patterns are very different than what we think they are. There's been some research actually that looks at growth patterns and shows that they have actual 24-hour discrete growth periods where they don't grow for 2 months and they literally grow overnight, where they've measured and weighed these kids for years and years and years, and they have these discrete growing periods. And so when your kid gets out of bed and you're like, wow, you look bigger, they actually do.
Wow, that's real, huh? Yeah.
It's real. And so their eating patterns are going to follow that. And so you may see a period of a lot of intake and just eating you out of house and home, and you think, wow, yay, we've turned the corner. And then 2 weeks later, they're back to their normal, just picking at their food and not eating very much. But I've had families say, oh my gosh, he had 2 bites of graham cracker. How can he exist on that? Well, some kids can, where for a little while they actually can. And if they're drinking milk and they're, eating here and there, it may not look like enough to us, but if they're growing and developing the way they should, then it's probably okay. And
you talk about eating temperaments. So it's kind of like our temperaments that we talk about with children. You can have a difficult temperament or an easy-going child temperament. And I'm thinking, it applies not just to kids, but to all of us. We're all we kind of just all are made up in our own unique way, right? For how we eat. I'm thinking of we have a couple that we've gone on some vacations with, and this friend that I go with, she just eats like a bird to me. Like, I feel like I am such a pig when I'm around her, because I'm constantly like, I can't get enough, especially when we're out of town and I want to try everything and it all tastes so good. And she's just, no, I don't think I'll have any, and I'll just have a little. And I know she's kind of conscious of her weight, and that's maybe some of it, but I really just think she doesn't need to eat as much as I do for some reason. And I mean, does it have anything to do with it probably has to do with our metabolism and our activity levels and just our makeup too, I would guess.
A lot of that. And for feeding temperaments, it's something that we've really looked at with these kids, is that you can be a person who just lives to eat. The food's just so exciting, and you're adventurous, and you plan your vacations around food, and you really like food, and you're like, and the child will be like, what's that, Mom? What's that? And they want to try everything. My 2-year-old right now, last night she had spinach with goat cheese and like some sesame dressing, which she's never had before, but she's very adventurous. Wow, my 6-year-old would run if I asked him to try anything like that. There's no way he would try that. And he's actually cried at the table when people have asked him to try something, and he says, no, I don't want it, and we've talked about, being able to say no, thank you, and all of that. But his temperament is very high strung and anxious and very emotional, and he's very particular about what foods are safe to him, what foods are comfortable, the way they look, the way they smell, the way they're shaped. There's all these factors. And then my oldest child is very just kind of easygoing, and sure, I'll try a bite, and he may not like it, but he'll always try something if it's new, and he's always been that way, and I think they come out that way, and it's not, I've fed them all the same, but they're all a little bit different, and I think that's what's really hard for families, especially if they only have one child, is not understanding that part, that they are not just carbon copies, they're not just little adults, and they are developing, and they don't have a lifetime of experience and exposure to foods. They have what we call neophobia, fear of new things, fear of new food, and it's a real thing, and it's protective in a way. If you look back to when we were, possibly hunters and gatherers, if I didn't know what a berry was, I'm not going to eat it. If I don't know that it's safe, I'm not going to eat it. It's kind of primal instinct to avoid food that's not familiar. So this is why kids, they go for the same mac and cheese. They want it to look the same every time, the same hot dog, the same strawberries or carrots or whatever that look exactly the same every time. And if you change the carton of the yogurt, they flip out, right?
Yeah.
So
that's interesting. You know, all you listeners out there, I'm sure you all have kids who are that way. They want the exact same thing all the time, and you're sort of thinking, how can they eat this every day? And it's so unhealthy. But that makes a lot of sense when you put it in that context, that it's safe. They know what it's all about. They know what it tastes like. They know that they like it. And that's why they maybe want it all the time.
Right. Their experience tells them that they can trust that food. And so with our extreme picky eaters, and kind of what we term extreme picky eaters, or, if their eating is affecting their social, emotional, or physical development. So social being like they can't go to a friend's house because they can't eat the food the friend's, serving, or they can't go to camp, because there's not enough food there for them to eat. Emotional development, if a child is really struggling with their anxiety and their feelings about food and they're fearful, that's a really, really big part of their life is eating, and it can hold them back. And then physical development is, just are they growing? Are they developing the way they should? But we also talk about, how is it affecting the family dynamic? And is there a lot of conflict at the table? Because if that's the case, then you're probably dealing with a more extreme form of picky eating. But I've seen families where the child really isn't that picky, but because of the battle that the parent has set up with the child, it's become such a huge conflict area where the parent is very, forceful about the child needing to eat certain things, and the child is saying, no, I don't want to, and so then they don't.
So and this is kind of that problem. Idea of what we were kind of alluding to earlier about relational eating. Is that the right term? I mean, so what does that mean? What do you mean by that?
Yeah, so relational feeding is just the understanding that feeding happens within the context of the relationship with your child. It's not a separate thing. And because your child trusts you as their parent to take care of them and to nurture them and to make sure they're safe, it's really important for them to feel comfortable eating what they are comfortable eating. And so when you push them past the point of comfort, they can lose that trust really quickly. And this happens all the time where I see families forcing a baby to eat more than they want. The baby is going to sleep, or they're pushing the bottle away, and they're like, oh, there's another ounce, you need to finish the bottle. Whereas the baby may not need exactly 6 ounces at every feeding, because that's not how we all eat. We don't eat the exact same amount.
Burp it up later anyway, so what's the point?
Right. But it's that idea that we have to get our kids to eat. And I wrote a blog post recently about, it's not so much getting them to eat, it's letting them learn how to eat, allowing them to be exposed to the foods that we're eating in a non-pressuring way so that they can learn, because it's a skill. It's a lifelong skill.
Yeah, and most people don't think about eating as a skill. And I like what you're saying. You're not getting them to eat, but you're letting them eat in the way that they want. And I know that another thing that you write about in your book, and that you've talked with me about, is how we are all different as well in sort of our tasting and sensing, like super sensors, right? There's people called super sensors.
Super tasters.
Super tasters. Okay. And it reminds me of the theory of the highly sensitive person that I really didn't learn about until a couple years ago. And I've always been one of those people that I'm always hot. I'm very sensitive to temperature. I don't sleep well because I'm a super light sleeper, sound, light, pretty much everything. And my husband would always make fun of me and be like, "You're so sensitive." And you take offense to that because you're like, I can't help it. Sensitive. And you take it like you're emotionally sensitive and you can't be so sensitive, that kind of thing. But when I heard about this term, the highly sensitive person, it's like, yes, I am sensitive. And that just means that I sense things very deeply and easily. And that the same applies to eating, right?
Absolutely. The research is interesting because they're actually showing that about 25% of the population is what they consider a super taster, meaning that they can taste more variety of flavors, that their palate is just more sensitive. And they think a lot of chefs are actually super tasters. If you kind of look at their eating, a lot of them say they were really picky as children, because as children, it can be overwhelming to your senses to eat things that are, that have a lot of flavor. And so it's a really kind of interesting normal bell curve, if you will, where you might have the super tasters on one end and then kind of the, more typical, not really one way or the other in the middle. And then the other side, we actually think there's the flip side of that, the non-taster, which is more just, that the person that just, like your friend, maybe that just eats to live, doesn't really care about food, isn't that just isn't that excited about food and the different flavors, and isn't a real adventurous eater, but just eats enough and they're fine. But it may not be very exciting for them. And for some of our kids that we work with, they really, we see a lot of kids that are what we call sensory seekers, where they're looking for foods that are crunchy, sour, spicy, salty, sweet, really strong flavors, really strong textures, because they like that input and they like to feel the food and they like to taste the food at really high levels. And they're the kids that are mouthing long past, 1 or 2, and they've always got their shirt in their mouth, or they're, chewing on their sleeve or things like that. And so, when we as parents can kind of accommodate that and allow for that, excuse me, and provide foods that give them what they're looking for, their appetite goes up, because they're like, okay, I'm getting what I need. This is what I'm looking for. And that makes me really happy about food. Yeah. It's more interesting.
Right. And in order for us to do that, we have to understand our kids and their eating habits and their preferences. Right. And this kind of goes even beyond eating. Of course, it goes with kind of everything in life. We need to understand our kids, sensitivities and their needs emotionally and physically and mentally and all of this, and as well as with eating. And, I know that, and you were referring to a story I'd told you about the first time I ever heard a friend say, a girl that I knew say that she just really didn't care about eating, that it just, she's like, I only eat to live. And I just thought, how is that possible? Because I love to eat. And how different our children can be when it comes to that. And most of my kids are pretty big eaters, but I have one daughter who I have to sort of ask her, did you eat enough today? And she's like, I don't know. Did you remember to eat? I ate, but what'd you eat? I don't know. Just kind of whatever.
Doesn't care. Yeah.
And that's fine. That's just her. That's how she is. But we need to not put pressure on ourselves as parents because that's how they are. Right. And just in the same way that I don't want my husband, blaming me for being a sensitive to temperature or sound or something. Yeah. We don't want to be blaming our kids for how they are. And this kind of goes hand in hand with the idea of the anxious child. And which comes first, I know that's probably a question I want to ask you is, I could see where you have children who have maybe an anxiety disorder and they just kind of are naturally more anxious. There are kids who are just naturally kind of more anxious personality. They don't really have a disorder. Then there are kids that have it to that level of disorder, which is kind of like you're saying, it impacts their lives in a clinically significant way. It interferes with social, emotional stuff like that. But on the flip side, I could see where kids who have that already might be more sensitive about their eating. But
Right.
I would also think that maybe it could go the other way around, that kids that are picky eaters end up getting more anxious, or maybe it's
Yeah.
like a vicious cycle. I'm not sure. What do you
Yeah,
think?
we see it, yeah, absolutely both ways. And the flip side is that when a child maybe has had a traumatic experience around
Mm,
food, they've either been force fed or they've, vomited or choked or whatever it is, and they've had kind of a traumatic event. And we think, oh, traumatic, oh, whatever, but it actually can feel really traumatic because you think about, how personal eating is, and it's
mm-hmm,
your body, it's your mouth, and it's the most sensitive part of your body. You have the
mm-hmm,
most nerve endings in your mouth of anywhere else in your body.
mm-hmm.
So if something doesn't feel right, or you have severe reflux, or you've got something other GI issue, I mean, constipation's a huge one. If you've got something that's always happening to you as an infant or a toddler or a preschooler and you don't know why, but you associate it with eating, then every time you go to eat you feel anxious, and it can be
Right.
really, really hard. And then the other issue too is that if you feel like when you come to the table someone's going to make you eat something you don't like, you're going to be anxious, and you're going to continue to be anxious about the food. And I think for the other child you're describing, if they're just generally anxious about life, then
Mm-hmm.
it just spills over, because that's just, eating is, like I said, just really personal.
Yeah.
And those
It's a big part of
sensitivities,
life too. It's
it
something
is, you
that
do
you
it
do
all the time.
all the time, every day.
Yeah.
You can't stop, so it never
And we
ends.
can make it worse.
Yeah.
As parents, we can make it worse or we can make it better. And,
Yeah.
just recognizing that it's not your fault.
Mm-hmm.
How your child is not your fault. It's not something you did wrong. It's not something you created. However, that's not enough, I think, to say, oh, it's not your fault, because then I find parents that doesn't help them. There's
Yeah.
still that guilt and that, what do I do? They want to help their child. And so we provide those steps in our book, as far as these are the things that you can do to support your child's eating and to give them the foundation that they need to be able to learn to eat a variety of foods for healthy growth, because that's what we want. We want the child to learn how to eat what's healthy for them. And I posted something today on Facebook that everyone's healthy is different. It's not the same for everybody. Nobody knows what every other person's body needs. And, they've started looking at that people take different, nutritional value from different foods, that whatever your body is needing. And so it's hugely a personal experience. And I think as parents, if we can let go of some of the control, at the same time, providing structure and providing, not letting kids graze in between meals and snacks, having very structured, scheduled sit down snacks and meals, because when is our job, the when of eating is our job. And not allowing the child to just eat whenever they want, because then they're not going to be hungry for those meals. We want appetite is something we can absolutely support as parents by how we present food.
And we can present it throughout the day, like you're saying. It doesn't have to be 3 meals a day. That's it. It shouldn't be, really. I mean, we need, like you say, having those snacks and regular times.
Sure.
So it's not like you're trying to restrict your child's eating or make them wait till dinner and starve until dinner. But
no.
Just setting up regular
just
times.
Routine. It's just having a scheduled routine. And what we found is that kids under the age of 5 need to eat every 2.5 to 3 hours to maintain a good blood level, blood sugar level. And children over that age, it's more about every 4 hours. They don't need to eat as often. But if your child isn't eating a lot at each meal or each sitting, then you may have to offer food more often in order for them to get what they need to grow. But
that's important.
Yeah,
so
every kid's different.
Every kid's different. So let me kind of recap some of the things that I've heard you say, some of the strategies that parents listening today can use and take home, and then maybe you can add a couple more in our last few minutes here. For one, I'm hearing you say we need to trust our kids a little bit more. And we provide the food, that's our job, but we need to let them sort of have a little bit more control in their life when it comes to what they eat as they get older, especially. And that it is a relationship that we're trying to foster between eating. And I liked what you said about family dinners can just be with you and one child, just two of you together. And eating is such a social thing, and it can be, you can really support your kids. So the other part of it I'm hearing is to make those meal times as peaceful and loving and light, and engaging as possible so that we can get the benefits from those, like being able to have that conversation that we need as a family. And then you're also saying that we can help reduce anxiety in children. And when we do that, that probably will help them feel better about their eating choices, correct?
Absolutely. They eat more. They eat more variety. And for the extremely picky eaters, it takes a while for them to feel comfortable enough maybe to venture out. But for children that are just kind of typically picky, this stuff can happen really quickly. Where, when you stop pushing, it's kind of amazing how fast kids will start asking for things. And if you just take that away, and it's funny because so many things can feel like pressure to kids. We talked about the bribing, we talked about, pressuring and saying, take a bite, eat this. But sometimes, shaming, oh, well, you didn't eat your vegetables, so you're not going to be strong. Or, saying, oh, well, you can watch TV because I can get a few bites in your mouth, that distraction. A lot of families will do that. Nutritional talk, like, oh, well, you need to have this before that because you need more protein, or this and the other. Like, small kids, they don't understand that. They don't understand the complexity. They think it either tastes good or it doesn't. That's all they care about. But I think the big one that parents don't necessarily think about is praise and what and telling a kid, oh, you're such a good kid, you ate all your vegetables, or I'm so proud of you, you ate your broccoli, or whatever. Because for the child that is just learning to maybe like the broccoli, you've kind of set them up for failure. So if next time you serve broccoli they don't feel like they want it, you've said, well, you're going to disappoint me if you don't eat it the next time. It's basically saying, well, you're not a good girl if you don't eat the broccoli, or if you don't eat this, that, and the other. So I think that piece is important too, for especially for kids that are really anxious and that are very sensitive about things, because some kids they feel that very, very subtly, and it doesn't have to be a real overt statement, but they can just take that feeling away from it.
Right. That is a wonderful kind of last point for us to end on here, is that we do need to praise our children. And I think that's across the board. I think it's so much easier to comment on the negative behaviors because they bother us and they disrupt our lives. But, there's that idea of catch them when they're being good and then tell them. Tell them what you see. Tell them the good things you see when it comes to eating, when they're making good choices, when they're eating well, when they're behaving, all these kinds of things, right? I mean, just every
the behavior. The behavior I think is important, like the sitting nicely at the table, having a conversation, passing the food nicely, using your napkin, things like that, and just being really matter of fact about the food and just not being judgmental about the food is a really important step for families to make, and saying, oh yeah, I like the broccoli too. Rather than good job eating the broccoli, because you're giving a more matter-of-fact statement and you're validating them that they ate the broccoli and liked it, but you're not saying you have to do it again tomorrow.
Right, or you're a good boy because you ate your broccoli, because we don't want them to think I'm bad if I don't eat broccoli.
Exactly.
Yeah, well, that's so helpful. And I know your book is just jam-packed with so many great ideas and strategies and tips and tools. And so I hope that all the listeners out there, I hope all of you will go out and get a copy for yourselves. Remind us the full title and where everybody can get it. And then tell us just a little bit about where they can find you online.
Yeah, so it's called Helping Your Child with Extreme Picky Eating, a step-by-step guide for overcoming selective eating, food aversion, and feeding disorders. And you can find it on Amazon. You can also find it through our website, which is www.extremepickyeating.com. And we have lots of resources there. We have a blog. We have all sorts of links to good tools and strategies and media things, and just lots of stuff for you to peruse through. New Harbinger is our publisher, and you can find it through their website. And also we have a Facebook page, which is Extreme Picky Eating Help. And then we also have Twitter. We can follow us on Twitter at capital EPE Help.
Great. And I love seeing you online. It's so fun to connect that way. And, they're just such great resources. And the book and the resources aren't just for those with an eating disorder per se. I mean, really, they can apply, like we've talked about today. I don't feel like I have an extreme picky eating child, but I can take all these things and they really can help anyone.
Absolutely. They help the siblings as much as they do the child that may have more picky eating. So yeah,
Perfect.
It helps the whole family.
Perfect. Well, thank you again, Jenny, for being here. Jenny McGlothlin, we're so grateful for having you here and learning so much about this topic that I'm sure we could talk forever about because there's just so much to know. So all of you out there, be sure to connect up with Jenny online and visit her website and go check out the book. And then make sure that you also join me on my website at drchristinahibbert.com. I'm hoping to have a guest post by Jenny on the website so you can learn a little bit more about this topic from her through my website as well. And don't forget to check out my books, This Is How We Grow and Who Am I Without You? And finally, to go on to Facebook if you're on there and like my Facebook page, and then see if you can find our Motherhood, Overcoming, Becoming, Flourishing Facebook group and ask to join it, because what a great community. We can talk about this topic and others and support one another that way. So until next time, everybody, I hope you will choose to grow through motherhood and not just go through it with us here on Motherhood Radio. And I will see you next time. Bye-bye, everybody.